And so I was called and advised to go and learn in a mainstream school. And the promise was they'll send a special education teacher to that school. But that was quite a hard experience. Shifting from a deaf school to a hearing school was difficult. We are seated in class in rows as we are seated here, and the teacher comes in front of class taking you through the lesson but just verbally speaking. So how do you understand as a deaf person what are they saying and you cannot perceive sound? It was quite difficult. Note taking was done by dictation, and my classmate would jot down notes, and then the teacher would tell me, just copy from your friends. So I will copy from my friends. But now if the teacher speaks faster, the student will also write faster, and I'll have to wait until when they're done, then borrow the exercise books in the evening for me to also copy their notes. That happened the first year, second year, third year, fourth year, until when I finished high school. I finished high school in that environment, being the only deaf student in a hearing environment. Now, after finishing high school, I had to go to college. So, where can I go? Which institution will accept a deaf student? So I stayed home the first year, second year, looking for a college that can accept me. Till the fourth year, that is when Ministry of Education thought that this deaf student is quite brilliant but has stayed home for 4 years. So they took it upon themselves to look for a college. But this college was quite a distant. And that is where I was advised to go. I went, I did my entry interview, which I performed excellently. And I was told to go back and wait till when they call me. So I went and waited for that call. I waited and waited and wondered why were they not calling me. So I followed up with Ministry of Education because I had passed the entry interview but have not been called for admission. So Ministry of Education went to do follow-up. Do you remember that there was a deaf student who came for an entry exam and schools have opened, students are learning? Then the school was like, oh, sorry, we forgot. No, they didn't forget. They didn't want me to join because I'm deaf. Now, after that, I got the acceptance letter. And that is when I started learning. Again, I was the only deaf person in a hearing environment. But I had to take heart. And I passed my exams. And after I finished college, I started working. So the same first school that I was learning, that is when I started my teaching career. I taught there for a while with hearing colleagues, being the first deaf educator. I was the first deaf educator. So I taught there for a while, and I thought, like, I want to advance from certificate to diploma. And therefore I applied for another college again. I went for the interview, which I also performed well. And then next year I got my acceptance to the college. Now my challenge was with the lecturers who were looking at me and wondering how they'll teach me. So I asked them, you can write notes and I can follow through that. But they were dominantly refusing, saying that no, they can't do that. And they reported to the principal saying that, oh, now this deaf student wants us to write notes or print handout notes for her. That is too much work for one person. Too much work. We rather have her out of the college. So the principal called me in the office and told me that I think we'll want you to go back home because you are not compatible for this learning environment. because these lecturers cannot teach you, right? And secondly, you wanting notes is waste of time. We can't print out notes for you. Will you pay for those material? Because it's expensive. So like, wow, okay. But one lecturer stood up and said that no, let's give her time. Let's see if she can perform well. Then if she performs well, it's fine. If she doesn't, then we can let her go. So till second year, I performed well. And I was writing better than my hearing classmates. I was performing better than my hearing classmates. And they're like, you see, she's quite brilliant. So after that, I went back and proceeded with teaching. And I thought again, I need to advance my education to the university and do my bachelor's. And people are saying, oh, you're deaf. Ooh, you can't pass in a university. It's quite difficult. But, you know, I asked, like, I need to work with an interpreter within that particular time, because I've worked without an interpreter in colleges, and I've worked with lecturers in colleges without sign language. I believe I can pass. So I believe if you as women can pass, I will also pass. I've already applied for that. And I got acceptance into that university. So after my admission, again, I was copying notes from my classmates. I didn't have an interpreter, just relying on copying notes until when I graduated with my bachelor's. And that wasn't it for me. I thought, like, I want also to do my master's, and I can do my master's. So I applied again. I went to do my master's. I went back to the university to do my master's. Similarly, the same experience. Being the only deaf person in a hearing classroom, I was even more confident, and I believed that he can manage it. So lecturers came, and they were finding it difficult. And when you have presentations, now the challenge is you have to stand in front of a class and do your presentation. So how am I going to do that presentation without an interpreter? Now, what I had to do is a friend volunteered to help me out with simultaneous text interpretation. And then later on, I got an interpreter, which was quite a relief until I graduated with my master's, then went back, proceeded to teaching, and thought to myself that I've taught for a while, but now I think I want to become a lecturer. So I started advocating with Ministry of Education, and they accepted for me to become a lecturer in special needs education. Yes, I'm retired currently, but I'm happy because I've become a role model to other deaf women that it's possible. It's possible. But you have to be self-confident. You have to believe in yourself. I've also written a book. And in this book, I tell about my life experiences, the challenges that I've gone through. And even during my retirement, after my retirement, I didn't sit back. I've been working with deaf women and established a hub for deaf women on sexual reproductive health education. which is an ongoing work. I'm also in the process of also writing another book, looking at the attitudes within the deaf community, me myself as a deaf person, understanding what happens within the deaf community. Why do we want hearing people to write about the deaf people? How deaf people feel, how deaf people learn, what their experiences are. Not really. We ought to write our own stories. We, as the member of the deaf community, we can represent ourselves better. Thank you. Thank you very much. Now, my presentation is about how lack. Okay, can we have the slide on? My presentation is about how lack of access to education, healthcare, interpreters, and digital tools affects the independence and rights of deaf women in Zambia. Next slide. Education is important. Education is important for all of us. If a deaf woman is educated, then she becomes powerful, because education is power. You have power if you have knowledge. If you have skills in different trades, you become empowered. If deaf women are educated, they become critical thinkers. You think on how to solve problems. For instance, me writing a book involves critical thinking. If deaf women are educated, they can make informed decisions. Not someone else coming in to make a decision on my behalf. My decision to go to the university was self. It wasn't dependent on anyone else. It was dependent on what I wanted to do. The inner drive was what was pushing me. Next slide. Education is also a powerful tool that can help women to achieve social change. Not thinking that you can't do this because you are deaf. You can't do. No. I can do anything that I want. I can do anything that my heart wants. I'm not limited because I'm deaf. No. Education also helps deaf women access different opportunities. They can access different opportunities. Whatever opportunities exist in life, you can do that. Next slide. Also, education brings about social exchange. The ability for you to interact socially, freely, with whomever you want. However, lack of access to education for deaf women, because being a deaf person and being a woman, and then you have a barrier in terms of access to education, it creates a multitude of challenges. Because you face barriers that affect your economic empowerment, barriers that will affect your employment. If you sit and you're not doing anything, you become poor. You invite poverty to your life. And we have a number of deaf women who are just seated, not having any economic activity to do. And they're thinking, where do I get the basic needs? Food, clothing. But you can do business. You can do housework. We understand that we have some companies that do refuse to employ deaf women, because when a deaf person comes to apply for a job, they'll say, okay, we have received your application, wait, we'll call you. But they never do that, and that becomes a challenge. Lack of access to education leads to isolation and exclusion. You are limited in terms of social interaction that can foster intellectual development, exchange of ideas. When you're isolated and alone, you are confined. The more you interact with other people, the more you exchange ideas, the more you grow intellectually, rather than being isolated. Lack of access to education also increases dependency. Dependency on your parents. You are a grown-up woman, but because of that, you're still dependent on your parents or your husband. And that sometimes creates fatigue, dependence fatigue within the parents, because they're providing for you everything. Even in marriages, sometimes the husband has a change of heart. And because of that, the life of the deaf woman becomes very difficult. Also, lack of access to education limits opportunities of participation in decision making, because they'll ask you, where are your papers? If you want to work, they ask you for papers. Where are your papers? What are your qualifications? Which qualifications do you have? Do you have a diploma? And now the qualification starts from bachelor's level. Most of employers will ask you for a degree and above. So what do you do if you have a diploma? Diploma is of less. Diploma has become less and less relevant. Lack of education also increases vulnerability and opportunities for exploitation and abuse. We have had stories of many deaf women who have been sexually abused, and you can't report to the police or your parent. If you report that to your parents don't really understand you. And you're the victim in that story. Even within marriage, your husband knows that you are less educated, and because of that, you experience domestic violence. But you're not empowered to go anywhere. They know that you are dependent on them. Because if you are empowered, you'll have the power to live. Next slide, please. If we provide education to deaf women, we're going to improve their living standards. Health is also something important, and access to health is crucial to deaf women. Because we also are susceptible to a number of illnesses. We need access to health. And in access to health, communication is key. However, many health practitioners cannot communicate in sign language. Imagine the experience of being expectant as a deaf woman. You go to a public hospital and you sit on the waiting bay. And perhaps there is a seminar on prenatal and postnatal care. You as a deaf woman, you're seated in that seminar without an interpreter, and then you go back home. What have you gotten from that interaction? Nothing. We have other deaf women who will go to the hospital and the doctor will start speaking to them verbally. How can I help you? And the deaf woman will gesture back that I'm deaf, and then the doctor becomes disoriented on how can they really communicate. Now, the challenge is, if the doctor cannot understand you, is it possible for them to give you the wrong medication? Something that does not align with what you are ailing from. Yes, there's the option of writing back and forth, but not all deaf persons have literacy skills. And sometimes we write with sign language grammar, which the hearing do not comprehend. And when you're going for diagnosis, communication also still becomes a barrier. Access to information is a struggle. You get that information way later compared to others. Remember during COVID, you remember when COVID pandemic was widespread. We had interpreters also being afraid of interacting outside, and they will isolate themselves in their houses. See, we are going to hospital with masks, and we faced a number of challenges in that particular setting. Being able to communicate effectively in sign language is very important in different settings, including hospital. There are a number of deaf persons who cannot use written communication. And without an interpreter, communications becomes difficult and limited. There was a time I had a seminar and I had a booking with an interpreter. However, an emergency came through and the interpreter could not make it to the seminar. So during the meeting, I was just there, not following anything. And my friends will raise their hand and interact in that meeting. So I felt left out. I had to sneak out and leave the meeting. That's an issue. So without interpretation, sometimes you feel socially isolated. You feel left out. Because interacting with people becomes difficult. Because it's an interactive meeting, and I'm an interactive individual. And I would want to interact with the interesting points that I have. But without interpretation, I'll feel left out. Lack of access to sign language interpreters also limit opportunities in education and employment. Because even when you're applying, then they'll start wondering, like, who is going to deal with the student? So they'll send you back. And you lose that opportunity. So in terms of your documents and papers, if you have access to interpreter, you can easily express yourself, represent your qualification, and help people understand your capabilities. But if you don't have access to interpreter, you're limited. You have deaf students who will pass their high school examination, join colleges. However, in those institutions, they are just seated without an interpreter. No access, making the education difficult. Where I lecture in Zambia, the Institute of Special Needs Education, we also have an issue with remuneration of interpreters. And then that leads to the deaf student having challenges in accessing that services because the interpreters are not paid. Next, we are going to talk about access to digital tools, which are quite important tools of access to communication. We deaf women have a challenge when it comes to accessing information, news, and educational resources. I'm here because of access to information via my phone. I'm able to interact with more information. Without access to digital information, it becomes difficult. Limited access to digital tools also hinders communication with other individuals. Communication becomes difficult without a mobile phone now, without a computer. You become isolated. And some women, because of lack of adequate education, they have limited interaction with digital tools. Because now we have online hailing taxis application that you can easily book and they take you to your particular destination. But if you have limited literacy, it becomes difficult for you to use this online application to hail a cab. And this is witnessed also in Zambia. Sometimes we have workshops that are done virtually, but they are not accessible to the deaf women, and becomes difficult for them to participate in them. Lack of access to digital tools also restricts job opportunities. There are a number of job opportunities virtually. If you look at advertisement of jobs, where they're being posted. Now they're being posted online. And you're able to go through that if you have access to it and find an opportunity that aligns with your qualification. But for deaf persons who have no access to these digital tools, they miss out on these opportunities. And again, it also leads to social isolation and limiting social interaction. You will be lonely. You're not able to connect with the digital world. You are not able to know what happens in other countries beside your own. National Association for the Deaf should work towards deaf rights and inclusivity, especially for deaf women. Training is key in this process. So now at this juncture, I'll want to open up the section for questions. We can have an interactive discussion in groups on, for instance, what are the main structural and technical barriers that deaf women face when trying to use digital tools in your country? What roles can your association play in reducing these barriers and strengthening access to digital tools for deaf women? And lastly, what partnership, resources, or policy changes are needed to create long-term solutions? Thank you. So we are going to have 30 minutes of discussion, and in your groups you'll have a representative who will come and present what you have discussed. Thank you. Now we're going to take questions that the audience have for you. Is that okay? Perfect. Yes, we have an interpreter who will be voicing, and I'm quite comfortable with that. Okay. I want to appreciate you for the wonderful presentation. Oh, sorry, my apologies. Are we set now? We good? Yes. I want to appreciate our presenter for the wonderful presentation. Okay.
Can the camera be on both the right side and the left side of the stage, please? Split screen.
If you can put us both on the screen, please. Are we set now? We good? Okay. Again, I want to thank our presenter for the wonderful presentation she has done. What she has said is true. Education is quite vital. Access to health is key. Imagine me as a deaf woman going to a hospital for maternity services, and you know how the bed tends to be structured. Your head is down, your legs are up, and the nurses are telling you, push, push. You can't respond because you can't follow that voice, so they slap you. Access to communication is key. So at this point, we want to welcome questions that you as participants may be having for our presenter. I see one hand up, 2, 3. Any other individual with a question? Okay, we have 4. So we're going to start with that bunch. If you have a question, you'll come in front, ask your question, then we'll go to this next person and the next person after that. Just come on this other side. Thank you. My question of interest is on technology. Looking at 2 aspects of it, especially on access to health services. 1, technology has facilitated texting. However, as we look at it, Kenyan Sign Language grammar and English grammar are quite different. So what do we have in technology that can help ensure efficient communication? Secondly is on menstrual hygiene education for deaf women and girls. Do we have a technology that speaks to this for deaf women and girls? Thank you. Thank you. So deaf women and girls in Zambia, they text using English, especially for prelingual deaf. They have not acquired any other language. Personally, I was born hearing. I'm a postlingual. I have another language. I can use a different language when texting to other hearing friends. However, for most deaf in Zambia are limited to English. When I am communicating to my boss, I have to write in exact English. And texting has been the only other alternative with us at the moment. Sorry, if you could just help clarify for me the question from the participant. Yes, on access to health information, sorry, menstrual health, I believe. Yes, that is quite a challenge. We don't have platforms for training on mental health hygiene. We have deaf girls who experience menstruation for the first time and they don't know what to do. So they are quite dependent on their friends to help them on even how to use pads. So that has become quite a challenge for the deaf girls. Did I clearly respond to your question? Thank you. We did have a participant who had a question. Oh, it was a comment? Okay, you're most welcome to raise your comment. First, I want to appreciate the presentation that has been done. My comment is with respect to the point on technology. Yes, texting back and forth has not been quite accessible. And just drawing in from my experience in Europe is the use of video relay interpretation services, especially when you are in hospital, so that you're able to have a conversation with the doctor and an interpreter facilitates that conversation remotely. So I think perhaps you can leverage on the new technology for that. I mean, that is just a proposal from my end. Thank you for that. If you can just clarify for me what the comment was. Yes, so the comment was on how to facilitate communication between a deaf patient with a doctor. With the use of technology now, you can use video calls to perhaps have an interpreter facilitating that communication remotely. So that was a comment. Well, yeah, I hear you, but that is not viable at the moment. Yes, we use video calls, but mainly limited to when we are communicating with our friends. However, in a hospital setting, that is not yet applicable. Not yet. Okay, I want to appreciate our participant for the wonderful advice on how else we can leverage technology to ensure access. So now I'll want to call another participant who has a question, I believe. Yes, thank you. My name is Florence. I come from Uganda, and I want to appreciate our speaker for the wonderful presentation. I've gotten wonderful learnings from your presentation. However, my question is, what are we currently doing to ensure that deaf women in Zambia who did not have access to education benefit from all this knowledge that you have to share? Thank you. In Zambia, we do have a project that focuses on women with disability. It is a women-led organization, and part of its membership includes deaf women. So we have programs that target remote areas where we go and do trainings to women with disability in those particular locations. And when we go there, we leverage on the established structures of women groups and work with them. In all our programs, we ensure that deaf women are also part of these trainings. And our trainings include advices and education on matters to do with health. We also have Deaf Association that focuses on training of sign language to medics. However, the challenge has been the rotations within the hospitals. Now, sometimes the staffs that we have trained in sign language tend to be transferred to different shifts or different hospitals. So when the deaf person comes looking for the staff who was trained in sign language, they find that he or she has been moved. So that is the challenge. And the other challenge is because deaf persons don't frequent hospital, the medic who have been trained in sign language tend not to practice sign language, therefore forgetting how to sign. Next, I'll want to welcome a participant from Uganda to come and ask their question. Thank you. First, I want to appreciate the presenter for that amazing presentation, your life experience, and I can really connect to that, the story of strength, which has motivated me to work harder in the field of advocacy. I have two questions. One is in relation to National Association of the Deaf, and secondly, in relationship to access to sign language interpreters, which I wanted to understand. Is it there is completely lack of sign language interpreters, or there ain't enough interpreters? Because it is my understanding that if I compare with other countries, Zambia has one of the strongest association of the deaf. So what happened? And yes, we understand that the association has a mandate, but we people, we as the deaf community, we are the association. We are responsible to work for the deaf community, deaf women, deaf kids. So when we say that the National Association must do A, B, C, D, and I'll wonder what is our role in this. Thank you. So just to take it again, I really do appreciate your presentation that had a feel of your personal experiences. But I have two questions about access to interpreters. What happened to the numbers? Do you have no interpreters, or the numbers are not sufficient? And two, who is the National Association for the Deaf? Because my understanding is we are the Association for the Deaf. So those were my two major questions. Thank you for clarifying that question. Yes, in Zambia we do have interpreters who are trained. However, the challenge is, if I'm sick and I call an interpreter, I have to pay for that service. So the interpretation service has to be procured by the deaf patient. However, the challenge is the purchase power of many deaf people. Without jobs, how can they afford paying for a sign language interpreter? Yes, when we are having workshops or seminars, it's fine. We can easily have access to interpreters, because the organizers of this workshop or seminars will pay for those services. However, if I have to procure interpretation services as an individual, I'm the one liable for payment of that service. So yes, interpreters are available, but if it's a paid service. The challenge is when a deaf person wants the interpretation services, but they cannot pay for that service. And there are moments where you can speak to a sign language interpreter and ask for them to volunteer when you don't have money. However, it's not sustainable. They cannot volunteer forever. So we have those moments where we ask an interpreter to offer their services pro bono, but it's not sustainable. Now, to respond to the second question, when I referred to the National Association for the Deaf, I didn't mean the organization. I meant the organization and members of the deaf community. So we have to be part of different activities under the National Association. Apart from the national level, you have charters at different regions, and all these charters share responsibilities. Am I clear in my response? Thank you. Next, allow me to call Rahab from Kenya to come and ask away her question. I'm a little bit tall, so if you can just reframe me. Perfect. First, I want to thank our speaker for the wonderful presentation. And the question that I wanted to ask is, I saw in your presentation you said you have deaf women who have experienced barriers in access to health services. My question is, do you have a legal framework that ensure deaf women have access to health services? For instance, having an interpreter in the hospital, but within the same breath, I want to understand what your thinking is as a deaf woman when you go to the hospital and you're consulting with a doctor and then you have an interpreter as a third party. Is it a situation that you're comfortable with? Do you think that having an interpreter as a third party affect confidentiality of the patient? And what is your approach when you are doing advocacy to ensure that deaf persons enjoy their right to privacy? Is it better to have one-on-one dialogue with the doctor or to have an interpreter? So is it okay? Which pathway do you feel works best for you? If you can just respond on those aspects. Again, just to take it back from international science, I'll want to understand what your thinking is in terms of having an interpreter as a third party in a conversation between a deaf woman and a doctor, and does that affect confidentiality, or is your preference rather having a one-on-one patient-doctor interaction with the medics knowing sign language? And do we have policy that support deaf women access to health services in your country? Thank you. Just to respond is, yes, in Zambia we have policies that ensure access not only to deaf women but generally to persons with disability. So that does exist. However, on the issue of using a sign language interpreter in an hospital, that is a personal decision. So if you prefer to have an interpreter or not is a choice that you make as an individual. It's a personal choice. If I'll want to tag along with an interpreter to access maternity services, it's fine, be it a man or a woman. So no one will control me, and we can't say that is right or it's wrong. So as a woman, if I'm expectant, I can decide to tag along with a male interpreter. Or feel like, I know I don't want to go with an interpreter, I would rather do right back and forth with the medic. It's my personal choice. Okay, so I'll want to invite the next participant to come and ask away their question. Thank you for bringing up the issue of access to sign language interpreters in hospital. However, just borrowing from experience from where I come from in India, we have cases where a deaf person will go to the hospital, and when they're ready to give birth, they will be tied down. That is, their hands and legs are tied down, and the medics will just shout instructions. In one of these instances, the baby died. And the thinking was, how do we sort out the challenge of access to maternity health and having the postnatal care that is also required for mothers who have just given birth? How do we go about that? Because this is something that happens more often. If you can just please clarify what she has said for me. Thank you. Yes, I'll do that. I'll take it for you. So we have this scenario where an expectant mother goes to the hospital and she's ready to give birth. Now, given the fact that the medics, the doctors, and the nurses cannot communicate, the lady was tied down. Her hands and legs were tied, and in the process of delivery, she gave birth, but the baby died. And also, after delivery, the mother developed complication. Now, this challenge of maternal death as a result of barriers in communication, how can we deal with that? Thank you for that clarification. I will respond that with my personal experience. So I can speak to what happened, what I experienced when I went to give birth. I may not be able to respond with respect to what others have experienced. And I do empathize with the challenge that you've expressed, being tied down when you want to give birth. But for me, when I was expectant, I went to the hospital and I was with my husband who tagged along. And when I started experiencing labor pains, I wasn't using my husband. So I really do empathize with the experience of being tied down. But my experience was going with my husband to the hospital. And then I was asked to go to the maternity bed. While there, we had nurses who were midwifing and another nurse who would focus on communicating with me. So we didn't have a sign language interpreter per se. It was more of a nurse who would use gestures. So the experience of being tied down is quite surprising to hear that that happens. I think there was a day that I went to the hospital and I was communicating to the nurse, and the nurse asked, like, how do I communicate to a deaf mother if I wanted to instruct them to push during delivery? And I told her, the same way that you have gestured to me, that is how you communicate. So this nurse was curious on how to communicate with a deaf person during delivery. And I told her that you can use the gestures that you have just shown me, and that will work. That's it. Okay, I think we are done with the questions. Perfect. Again, I want to appreciate our presenter. Just a moment for us to consult. So what we are going to do next is we are going to do group discussions. In the rows that you are seated, you can just form groups. And if you remember the question that I had shown during presentation, I believe you have 30 minutes, if I'm not wrong. No, 15 minutes. So I'm told. We have 15 minutes for group discussions. If the technical team can please project the questions again on the screen. Now, for the first question, you will be discussing what are the main structural and technical barriers that deaf women face when trying to use digital tools in your country. And for the second question, you'll be discussing on what are the roles, what roles can your association play in reducing these barriers and strengthening access to digital tools for deaf women. And then lastly, you can discuss what partnerships, resources, or policy changes are needed to create long-term solutions. Okay? So those are the questions for discussion.